So you're in chronic pain. Chronic pain being any pain that we experience that goes on perhaps longer than the time it should have taken for the tissue structure to heal. And so we usually colloquially call that after around about 6 months. So any pain that continues anywhere in the body beyond about 6 months, we would normally classify as chronic. And so what is happening with chronic pain? Why are we in chronic pain? And the answer to that might be quite surprising, and it's really usually only one thing. You're in chronic pain because something has gone wrong. And that problem is the deepest problem that we see in clinic. And the reason why it's hard is because, generally speaking, the thing that patients are looking for is a structural reason for that. They're looking for a reason on an X-ray or an MRI scan to account for why they are in chronic pain. But that actually isn't the problem. Chronic pain only becomes chronic when something has gone wrong. And the thing that goes wrong is that normally when we hurt ourselves, we experience pain, and then when we heal, the pain goes away. So the thing that's actually gone wrong in the majority of cases is not that there is a structural problem, but that the brain believes that there is still a problem and continues to give you pain. And that distinction is the most important thing, because the patient, when they come to see us, is expecting for us to say there's a structural problem, and if we heal the structural problem, the pain will go away. And usually that's not the case, because the structural problem by and large is already healed. Even if you have quite advanced arthritis, no more healing has to be done. It's as good as it's going to get, and yet you're still in chronic pain. So to reverse people out of chronic pain, the strategy is to almost look at the structural problem, accept that you have structural damage, that it's healed as well as it's going to heal, and then almost ignore it. Because we see many patients in clinic with quite severe arthritis and quite severe injuries, and actually they experience no pain whatsoever. Indeed, there's been lots of studies that show it's almost impossible, based only on the structural X-ray or structural MRI, to actually figure out who's in pain. And so what that means is you might get 50 MRIs of people with really bad looking spines and 50 MRIs of a spine that looks relatively healthy. And this study has been done where we've asked consultants to, based only on the X-rays, based only on the MRI scans, figure out who's in pain and who isn't. And they couldn't even nearly get it right, which tells us that the structural problem often is not the important thing, but the patient, when they come to see us, is prioritized and is concerned about the structure. And so once we figure out that there's enough movement in there and that enough healing has happened, we don't worry about the structure anymore, because the structural problem no longer is the thing that's gone wrong. The thing that's gone wrong is that the nervous system is still acting as though you're still injured, is still trying to protect you. And that's the thing that's gone wrong, because, as we say, once the structure's healed, the pain should go away. That's the normal flow of things. I cut myself, the cut heals, the pain goes away. So that what has actually gone wrong when we're in chronic pain, what is actually the problem? The problem is that your brain still thinks that you're injured and still thinks that it ought to give you pain. And it's that in the clinic that we're trying to heal.